chest, we inspect different parts of the chest, palpate and percuss the chest, auscultate the lung sound by using stethoscope. Is that okay with you?
Yeah, that's fine.
Okay. Do you have any pain anywhere?
No, sir.
Do you have any questions regarding the exam?
No, sir.
Before assessing, expose the chest area. For examination, provide comfortable position and privacy for the patient. Inspect the chest for cyanosis, shortness of breath and curve, and also assess for peripheral cyanosis by looking at the patient's hands. Mr. Ajay, could you show your fingers for me like this? Here we can see for bruising or thin skin or tar staining. Could you please bring your fingernails together for me like this? Here we are assessing for clubbing of the finger and also check for Chambrow's window test, that is a diamond shaped space between cuticles. Now to assess the tremors, ask the patient to bring out his arms in front. Could you raise your arms for me? And extend your wrist backwards. Here we are assessing for hysterexis, that is caused by CO2 retention. Inspect the central cyanosis by looking at the patient's face and also assess for hypoxia. Inspect the chest for chest wall deformities and scar, which may be of sternotomy and thoracotomy, etc. Assess the tracheal position by gently palpating the midline of the neck. Apex bead should be palpated on 5th intercostal space at mid-clavicular line, that is assessing chest expansion by placing the examiner's hands around the chest quite tightly, then ask the patient to take deep breath in and out repeatedly. Mr. Ajay, can you take deep breath in and out slowly? Reduced chest expansion can be seen in lung collapse and pneumonia. Percussion of the lung. Percuss the lung field for normal resonant sound. Note for the cardiac dullness. Dull percussion denotes of consolidation, collapse, effusion of the lungs. Now auscultate the lung sound by using stethoscope. Take deep breath in and out slowly. Normal vesicular breathing. Altered breathing pattern includes like inspiratory stridor, wheeze, crackle course, fine crackles. After assessing the lung sound, instruct the patient to say 99 when stethoscope is placed on chest. Mr. Ajay, please say 99 every time when I place a stethoscope on your chest.
Yes, sir. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99, 99, 99.
This test is done to examine occult resonance. If it hears increased occult resonance, it's due to consolidation, lobar collapse, tumor. If it hears decreased occult resonance, it's due to pleural effusion. Now closely inspect the posterior chest wall and examine for chest expansion. Place your hands tightly around the chest again and instruct the patient to take deep breath. Mr. Ajay, could you please take deep breath slowly? In, yes, out. Symmetrical chest expansion should be noted. If unilateral chest expansion is observed, then it is due to lung collapse or pneumonia. Percuss the posterior chest wall by tapping on patient's back and instructing him to fold his arms. Mr. Ajay, can you fold your arms for me? Yes, thank you. Dullness is heard due to collapse or consolidation of the lung. Stony dullness is heard due to pleural effusion. And hyperresonance is heard due to pneumothorax. Auscultate the posterior chest wall. Mr. Ajay, now can you take deep breath and out for me? Vesicular breathing sounds are normal. Inspiratory stridor is heard for upper airway obstruction. Wheezing is heard for asthma and COPD. Coarse crackles is heard for pneumonia and pulmonary edema. Fine crackles are heard for pulmonary fibrosis. Assess for occult resonance in posterior chest wall by commanding the patient to spell 99. Mr. Ajay, can you spell 99 for me?
Yes, sir. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Increased occult resonance is due to consolidation, lobar collapse and tumor. Decreased occult resonance is due to pleural effusion. And now assist the sacral edema, press the lower back. Mr. Ajay, this completes your chest examination. You can get relaxed now.
Okay, sir.
My client Mr. Ajay has normal shape, size, symmetry of the chest without any deformities noted. Respiration and pulse rate are normal. Normal percussion sounds can be heard on anterior and posterior region of the chest. On auscultation, he has normal vesicular breath sounds. There is no any signs of ventricular failure or deep vein thrombosis. Further moving on to abdominal examination. Mr. Ajay, I will now inspect the abdomen for size and shape. Auscultate the abdominal sounds by using stethoscope and palpate and percuss your abdomen for internal organs. Is that okay with you?
Okay, sir.
Do you have pain over your abdomen?
No, sir.
Do you have any questions related to the exam?
No, sir.
Okay. Let's continue our abdominal exam.
Sure.
Initially, inspect the abdomen for any scar marks, mass, discoloration or any stoma. To examine abdomen closely, provide supine position to the patient with the hands lying at the side. Assess different area of abdomen. They are right hypochondriac, epigastric region, left hypochondriac, right lumbar, umbilical region, left lumbar, right iliac, hypogastric region, left iliac region. Now I will auscultate your abdominal sounds with stethoscope. Is that okay with you?
Yes, sir.
Okay. Normal bowel sounds can be heard as also note for any abnormal sounds such as brood sounds. Now lightly palpate the abdomen for any tenderness or pain by seeing patient's face for signs of discomfort and also assess for any abdominal masses. Mr. Ajay, now I am going to gently palpate your abdomen. Tell me if you feel pain.
Yes.
Do you have any pain?
No, sir.
Now perform deep palpation. Mr. Ajay, now I am deeply palpating your abdomen. Tell me when you feel discomfort or anything.
Sure, sir.
Please can you bend your knee for me?
Yes, sir.
Okay. Do you feel pain?
No, sir.
Okay. You can get relaxed now. Now I will percuss your abdomen. Is that okay with you?
Sure, sir.
Okay. Percuss the border of the liver. Note the sound changes from resonant to dullness. Percuss the splenic border for splenomegaly. And also percuss the suprapubic bladder for urinary retention. Note for shifting of dullness which suspects ascites. Mr. Ajay, this completes your abdominal examination. Thank you so much for your cooperation. You can get relaxed now.
Okay, sir.
Mr. Ajay has normal shape and size of the abdomen without any scar, mass, discoloration or any stomas. On palpation of the abdomen, in all quadrants, there is no pain or tenderness present. Abdominal percussion shows normal resonant sound. On auscultation of abdomen, bowel sounds can be heard. Now moving on to upper extremities.